So we'll talk about the management pathway for overactivity of the bladder. This is very important to understand that you have a lot of choices, and to show you the entire pathway is important. So we've done the medical history, the physical examination, diaries, urodynamics, and cystoscopy. The next and the most important thing is behavioral modifications. That is the key, whether it's, and we'll talk more about that. Then we do the pelvic floor assessment or pelvic floor therapy, medication 1, medication 2, and if that all doesn't work with combination, then we go to reevaluation and then advanced therapy. So there are a lot of options available, but the most important thing to understand is that all these have to be done collectively. We cannot fall in love with one medication or the other. If you do not do the behavioral modifications, you do not do the time voiding, it's not going to help. Overactive bladder is very dependent on behavioral therapy. So that's key. So we'll talk about that. We'll talk about pelvic floor therapy. There are 2 types of medications we'll talk about, and we'll talk about certain special conditions such as bedwetting and a bladder infection, or if there is a prolapse. So next, let's talk about behavioral therapy.